So for this one, when we start working on mandibular views, the issue that seems to be a constant problem is the tongue interfering in our film placement. So ideally what I want to do is I want to have the tongue on the opposite side of the sensor just to minimize any interference. And most of the times I can make that happen just by pushing it out of the side and pushing my sensor back in like that. Okay, so what I'll use on the opposite side of the sensor is paper towel to keep it in place. And again, just make sure you're pushing it back far enough that you see just those canine teeth at the end of the sensor, like that. Okay, so our vet rep is just making it look bigger than it is, but there we have the canine teeth just within that inactive area on the sensor. For this view, I'm going to be able to get both canine teeth as well as the incisors. So what I'm going to do with the cone is I'm going to get it low enough so that it's right in between both canine teeth as well as the mandibular incisors. Okay, so from my view here, I can see that it's going right in between both of those. Now what I'm going to do, this is a tooth at the the front of the animal. So what I'm going to do is I'm going to stand at the side in order to show the direction that those teeth go into the skull. So I have incisors and a canine tooth in this view. What I want to do is use the mandibular canine teeth to set up my angle. We talked about on the maxilla how the teeth are more upright on the maxilla. So if you follow the crown, then you'll probably be lined up really nicely for the root. But the mandibular canine does curve quite distally into the skull. So what you have to do is ignore the crown to some degree. And remember that that root curves distally into the skull. So what I'm going to do is I'm going to stand at the patient's side. And I'm going to look at the mandibular canine tooth. And I can see that the tooth, if I ignore the crown, the root does curve quite distally into the skull. From the side, I can see the side edge of the sensor. So halfway in between leaves me about here. And that's what I'm going to aim my cone at. Okay, so you want to keep it low enough that you're centered in between all 8 of those teeth. But when you line it up, your roots are going to the skull like this. You can see my sensor. So this gives me my bisecting angle. Just, whoops, like that. And that's how I would image the mandibular, incisors, and canine together.